Breast milk is the ideal food for infants. According to the World Health Organization, breastfeeding is one of the most effective ways to ensure child health and survival. Breastfed children perform better on intelligence tests, are less likely to be overweight or obese, and less prone to diabetes later in life. Women who breastfeed also have a reduced risk of breast and ovarian cancers. Exclusively breastfed is recommended for 6 months. Sometimes breast milk is not enough for an infant. The most commonly low milk supply is caused by not thoroughly and regularly removing milk from the breasts. Only 5% is because of medical condition or anatomical issues. But what is the exact causes of low milk supply? Supplement formula. If you've added formula to your baby may take less milk from your breasts. Finally, your breast produces less milk. Infrequent feedings. 4 or more hours intervals may cause low milk supply. If your baby is a good sleeper, there is risk long intervals. Short feedings. If you cut nursing sessions short 5 min or less each breast, it increases risk of low milk supply. Less demand, less production. Pacifiers. For some, but not all, babies, use of pacifier lessens suckling on the breast. Less suckling can mean less milk production. Here are 11 ways to boost milk supply. 1. From the day first, allowing mothers and infants to remain together 24 hours a day. Not to give supplemental formula if not medical necessary. 2. If the infant is unable to breastfeed, it is recommended that the pumping or hand expression of milk begin within 2 hours of delivery, and be done at least 8 times every 24 hours. 3. Increase skin-to-skin contact between you and baby, and allow baby unrestricted breastfeeding. It stimulates milk ejection reflex and promotes frequent feeds. 4. Latch is important. Latch refers to how the baby fastens onto the breast while breastfeeding. A good latch promotes high milk flow and minimizes nipple discomfort for the mother, whereas poor latch results in poor milk transfer to the baby and can quickly lead to sore and cracked nipples. 5. Nurse frequently. Demand and supply chain is most important. If baby is suckling frequently, breast produces more milk. 6. Offer both sides at each feeding. Let baby finish the first side, then offer the second side. 7. Avoid pacifiers and bottles when possible. 8. Give baby only breast milk. Avoid all solids, water, and formula if baby is younger than 6 months. 9. Breast self-massage is recommended to stimulate the milk ejection reflex and to physically promote the flow of milk. Some experts recommend using a breast pump after each breastfeeding session. It is needed to ensure not to left milk in the breast. 10. If the baby cannot nurse effectively, frequent drainage of milk from the breast through hand expression or an electric double breast pump is recommended. 11. Use of galactagog is a substance that promotes lactation in humans. Domperidone and metoclopramide increase prolactin level. There is some evidence to suggest that mothers who are unable to meet their infants' breastfeeding needs may benefit from galactagogs. Domperidone may be an option for mothers of preterm babies who at over 14 days from delivery and after full lactation support still have difficulty expressing breast milk in sufficient quantity for their child's needs. Unlike metoclopramide, domperidone does not cross the blood-brain barrier, and does not tend to have adverse effects such as drowsiness or depression. Domperidone is not approved in US. But it is approved in Australia. Herbals and foods used as galactagogs have little or no scientific evidence of efficacy, and the identity and purity of herbals are concerns because of inadequate testing requirements. The herbals most commonly cited as galactagogs are shatavari, asparagus racemosus, fenugreek, Trigonella phenumgricum, torbangun, Coleus amboinicus, fennel, Feniculum vulgare, milk thistle, Silybum marianum, chasteberry, Vitex anus castus, goat's rue, Gallica officinalis.